Welcome everyone to Vital Wisdom with me, Dr. Eli Camp. You know, when people come in to see me for the first time, or they stop me in the grocery store line or at the bank or anywhere I'm out and about, they are often looking for something natural to treat X, Y, or Z. And they'll ask me, Doc, I've got this thing. I'm just wondering if there's something natural I can take instead. And I always have to explain to them that I cannot give them a simple answer. I can't really say, oh yeah, you could take this herb instead of this drug that you've been taking. And that always leads to a discussion about vitalism, which I talked about in the last episode, and the innate intelligence of the body. The vis medicatrix naturae, or the healing power of nature and the vital force, and how each person needs something individualized and specific to them, which often leads to them just sort of looking at me. They have no idea what I'm talking about. And so I have to explain to them that what I do, or other vitalist practitioners do, is different from what they have been trained to expect from a physician in general. I explained that what I do is to engage and assist the innate intelligence of the body so their body can heal itself. Okay, what does that mean? The innate intelligence of the body. How does that work within the body? And these are good questions, and being the thinking creatures that we are as humans, we want to know. Inquiring minds want to know and all that. So in my last episode, I said, we don't know how it works, this innate intelligence, and that's true, but we can see it at work in the body. We can stimulate it and assist it. There's laws of nature that help guide us in this, but we cannot explain how, all capital letters here, how our body knows to do this. And I use lots of examples with people as I find this helps them understand more clearly what I'm trying to explain. So I'll give you an example. Let's take a baby who's crawling around and they get a cut from something. And it's a pretty deep cut. Not so bad they need stitches, but over a couple of days and with no intervention from anyone, this is what happens. Platelets in the bloodstream clump together to form a clot. And that stops the bleeding and it protects the wound. That clot contains fibrin, a protein that kind of forms a net to hold the clot in place. And red blood cells help create collagen, which are tough white fibers in the body. And this forms a foundation for new tissue. The wound starts to fill in with new tissue. This is called granulation tissue. We see a scab form and new skin begins to form underneath. As the wound heals, the edges of the scab pull inward and the wound gets smaller and smaller, and eventually scab falls off, the wound is healed, and we rarely even see a scar. Now, that's the chemical and physical properties that can be observed. But how does the body know how to do this? Some scientists would say, oh, it's cell signaling or something like that. But I ask again, how does the body know what to do? This is not an explanation from the mechanistic side of medicine. There isn't one. But in my world of medicine, I simply accept that this is the innate intelligence of the body. It knows what to do, and while it needs no help from us, we can assist that healing of the scratch or the cut by keeping the area clean, maybe doing a little hydrotherapy, which assists the body and stimulates the healing. Perhaps we put some calendula salve on it, which also helps the body by stimulating, skin growth. And maybe we even use a homeopathic remedy to further assist the body. With our extra help of assisting the body, we'll likely see it heal in half the time. Now, that's a simple example of an acute injury. Well, what about a chronic illness like eczema? So I'm going to talk about all of that in coming episodes. We'll talk about lots of different conditions and different things that we can do. But my point here is that there is an intelligence in the body. It knows what to do. We can observe it, even if we don't understand how it knows what it does. You know, someone asked me once, how is this innate intelligence different from conscious mind functions when it comes to healing? And that's a really good question. So the conscious mind of the human thinks about what can we do to make something go away. In the example of the baby, it would be keeping the area clean, the hydrotherapy, the salve, the homeopathy. But make no mistake about this. We are not doing the healing. We are assisting the body and its innate healing intelligence. This becomes really important when we get into serious wounds and chronic disease. The body heals itself, and humans can either assist or oppose this healing. I mentioned the laws of nature briefly in the last episode, and the laws of nature include the defining of a pattern to healing that allows us to recognize when the body's innate healing ability is actively doing its job. There are many people who have written about the laws of healing and what happens when you violate the laws. Just to mention a few, Henry Lindlar defined disease as the natural and inevitable result of violation of nature's laws. And I've seen that hundreds upon hundreds of times. You violate the laws of nature, you end up with disease. Catherine Ponder and Robert Crosby wrote about the dynamic laws of healing. And within the naturopathic field, Constantine Herring developed Herring's laws. All of these basically come down to the same points. When the body has what it needs and the toxins and obstacles to cure have been removed, it heals from the inside out, from the most important to the least important system, and in the reverse order of the appearance of symptoms. These laws are really important because they guide a practitioner in knowing when the body is doing what it is supposed to be doing. For example, if we look at a child with chronic eczema, ear infections, and bronchitis, we know that the most important system that needs to be healed is the respiratory system. It's more critical to life than the ear infection or than the eczema. And then the ears would heal, and finally the skin. And if healing happens in that order, then we know the body's innate healing intelligence is intact and working as it should. We know we are assisting the body with the therapies that we choose to support the body in its healing. What we can observe is that when the conditions for health are present, the body can and will heal itself, and the body will reach its own individual level of optimal health over time. And when the conditions for health are not present, when we violate the laws of nature, disease presents itself, and symptoms are the way the body communicates to us. It's not directly communicating to us, it's just communicating that something is wrong. And we have to use the symptoms to guide us in assisting the body as it goes about its business of self-healing. And if we suppress those symptoms, we work against the action of the body and we create more serious illness. It really is that simple. So you might be wondering at this point, how do we assist instead of work against this innate intelligence? And I'll talk about this in great detail by condition, right, as I travel along this journey with you. But an example is helpful here. So aside from the very basics of feeding the body nutrients it needs and removing toxins and removing obstacles to cure, We observe the symptoms of illness and apply various helpful treatments and practices. Let's take a fever. So this is the body's first response in a variety of situations, one being an overgrowth of bacteria. So let's say whether the body is healthy or not as healthy, we get a large enough exposure and a bacteria starts to flourish in the body. What's going to happen? Well, a fever. The body heats up. It's trying to break down the bacteria. And if we suppress that fever, we are working against the body's innate intelligence. We are preventing it from doing its self-healing. So to work with the body, right, instead of using a fever reducer, we work with the body to assist its healing. We would fast. So in Nature Cure, when the body's temperature is elevated to the point where we say it has a fever, we fast so that we can let the body focus all of its attention on what it's trying to heal. We could definitely, we want to stay hydrated, because when the body gets hot, it needs more of that hydration. And when I say hydrated, I'm talking water. We could use hydrotherapy to support and stimulate the immune system. And I'll talk to you a lot about hydrotherapy, but we also need to rest, and we need to expose the body to warm sunlight and convalesce, right? The fever will go as high as it needs to go. I'm not going to give you numbers here, because sometimes the temperature I allow a body to go to is higher than many people are comfortable with. But as long as I'm keeping the body hydrated, and sometimes I have to use cool rags on the head to protect, this part of the body, the fever will go as high as it needs to go. The assistance we provide with those things I mentioned help move out byproducts and of the healing action, because when everybody's healing, you produce certain things in the body, and reduce the load on the body from its everyday activities. The fever will break, and the body will be better for it, because it was allowed to complete its healing activity, its self-healing. What about eczema? Let's go back to that. Well, eczema is a symptom that there is some type of reaction happening within the body. It's actually a healing reaction that manifests on the skin as eczema. And in very young children, it's usually coming from something they're consuming that their body has trouble processing, or not consuming something their body needs, or extreme stress. Something is happening in the body that it needs to heal, and as it does that, we see symptoms of that healing on the skin as eczema. Skin conditions are usually relatively superficial, and if they're not suppressed, they're really good indicators of what we need to go and look for in the body to help assist it in its healing. So we investigate a variety of things: a food sensitivity, a vitamin or mineral deficiency, poor gut health, and therefore poor absorption or elimination. And in very short order, once we've removed the trigger and maybe done some herbs or hydrotherapy or homeopathy, the body finishes up its healing deep within, and the eczema resolves. All non-suppressive assistance is good, right, as we're helping the body. If we suppress the eczema, say with a topical or internal steroid, we are directly opposing the body's attempt to heal itself. We're saying, hey, this symptom, the sign that something's wrong, well, it's not so important. We know better. We're just going to suppress that. Well, we oppose the body's healing. That is not assisting, that is opposing. And the illness becomes more complicated, such as something I've seen in hundreds of children where this is the approach, where they then develop ear infections, they then develop chronic respiratory conditions, and so many other things can follow. Understanding this concept of innate intelligence and self-healing shapes and guides each person, especially the doctor or other health practitioner, in choosing natural therapies and preventative health practices. Unless one is really clear really understands that the body is already attempting to heal itself every second of every day, and that it's doing that according to the laws of nature, if you don't understand that, then chosen therapies can cause more harm and deeper illness. With this understanding, we can explore what each person needs to do, eat, take, avoid, to have a body that can quickly and efficiently heal itself every time. So to that person who asks me what natural thing they can take to do X, Y, or Z, I don't go through that whole big long thing, but what I can tell them with a lot of confidence, because I've seen it, it's inevitable, right? When you assist the body and allow it to self-heal, I can tell them with confidence, your body can heal itself, and that everything a doctor like me does can be considered a natural alternative. It just isn't as easy as saying, oh, take this herb or supplement instead of that drug. Because the goal is not ever to treat X, Y, or Z. We don't treat X, Y, or Z. We discover what each person's body is trying to tell us and then assist it in healing itself. So we treat the person. We restore the conditions for health. We do not treat X, Y, or Z, and that's why it's not a simple answer. You know, at the end of each of my podcasts, I'm going to give you some little pearls. Things that you can do instead of reaching for a suppressive substance. And the pearls will usually be for first aid or acute things, because chronic conditions take a lot more thought, as I just explained, right? So homeopathy is one of my specialties, and we have a whole couple of episodes I'm going to devote to talking to you about homeopathy. It is a safe and effective approach to assisting the body in its self-healing that can be used for all ages. It can be used alongside other therapies. It's really awesome. Something that we have in our house, car, anywhere we are, is a homeopathic arnica. And we use this for bumps, bruises, other types of trauma. And I like the strength of 30C or 200C to have on hand, or both. It speeds healing. It reduces pain in a non-suppressive way. And I usually dose 3 pellets at a time, as often as needed, and it usually takes a couple of days for the body to heal itself up. It's one of those natural remedies that you should have on hand, and anywhere that you might need to reach for something should you get a bump or bruise or some kind of injury. So that's homeopathic arnica, and you can get that online. You can get that at most health food stores. It definitely should be in your first aid, your natural first aid kit. For strains and sprains, arnica is great as well. But I also would say learn contrast hydrotherapy, also known as alternating hydrotherapy. This is the use of hot and cold water to assist the body in its healing. And many folks will say to ice a sprain. I never do that, ever. I will, if it's a foot or a wrist, something that you could submerge in a container of water, you take 1 hot water container, and it's about 105 to 110 degrees, and most people can handle that level of heat. And you put it in that container for 3 minutes, and then you quickly move it into a container of very cold water, even with a few ice cubes in it. It's the difference between the hot and the cold that give us an action of that we're looking for in the body. And I'm going to talk to you more about hydrotherapy as we go. But this is a quick and easy way to deal with this strain or sprain. You repeat that 3 times. So 3 minutes in hot, 1 minute in cold. Repeat 3 times, always end with cold. You can add magnesium salts like Epsom salts to the hot water. You could put a few drops of lavender essential oil in. That's a pain reliever. And you want to repeat that whole treatment 3 or 4 times in the first 48 hours. And then you can just do it a couple of times a day. You do, if it's a foot, you do want to elevate the foot as much as possible. And if the strain or sprain is somewhere that you can't submerge it in a container of water, you can apply hot and cold towels. So same temperatures, you put a hot towel on and then cover it with a dry towel or blanket for 3 minutes. Then quickly swap out the hot towel for the cold towel, cover it, alternate, this way 3 times, repeat the treatment 3 to 4 times in the first 48 hours. It's the same thing. So next week, we're going to talk about the core principles of the mechanistic model. So I've told you a lot about the core principles of the vitalistic model, the nature cure, naturopathic, old-time naturopathic medicine. But what about the core principles of the mechanistic model? I mean, these are important to understand too. Understanding how just being in that system of medicine can limit our understanding of health and disease, the strengths and limitations of each model in today's modern healthcare, and why you might choose a vitalistic approach over mainstream medicine and vice versa. Why might you choose mainstream over a vitalistic approach? In what situations? Because I think it's really important before we go too much further and talk any more deeply about the way I practice medicine, is to understand that there is a place and time for everything that we have available to us today. I'm also going to share the story of a patient so you can see what this looks like in real life. Now, I have permission from the patient. We won't use her real name, but it's the story of a woman, and I treated her a number of years ago. We still talk. She's doing great, by the way, but it's the story of a woman. She was 68 when she came to see me, and she had a history of chronic migraines, debilitating almost every day, joint pain and fatigue. I think she had a diagnosis of chronic fatigue. She might have had a diagnosis of fibromyalgia. 20 years on and off antibiotics and immune suppressants and pain meds. And she really was just hanging on by a thread. And we applied these principles of assisting her body and supporting that innate intelligence. I'm really excited to share that with you next time. Thanks for joining me today on Vital Wisdom with Dr. Eli Camp. I hope you have a wonderful week, and I'll talk to you next Sunday.